The sneeze reflex, a natural defense reaction against foreign particles and pathogens such as bacteria and viruses. A defense reaction with a risk of infection for the human respiratory tract. Like tiny pirates, the pathogens board the mucous membrane and cling tightly to it. This process is called adhesion, and it is just the beginning. The viruses forge their way towards the cells and enter them. It is like a chain reaction. Once inside, the viruses force the cells to exclusively produce new viruses, which in turn attack other cells where they multiply explosively. The result? An acute infection of the respiratory tract.
At first, the symptoms are quite harmless, a tickle in the nose, a scratch in the throat. Then the situation gets more complicated because this is a descending infection. It goes on to affect the larynx and the bronchial tubes, and only then does the patient go and see a doctor, which means that in daily practice, we're usually dealing with a fully developed disease.
Acute bronchitis is one of the most common conditions a family doctor has to deal with. In Germany, patients seeing a doctor due to a common cold or influenza infection account for no less than 650 to 850 million euros per year in expenses. To therapists, this is a challenge which keeps repeating itself year after year, because an inadequate therapy, or no treatment at all, may have severe consequences for the patient.
Acute bronchitis and the approach to treatment should be taken seriously right from the beginning. In 30% of cases, bronchitis will turn chronic, involving the risk of developing asthma or chronic obstructive pulmonary disease, which is the main problem when the condition is left untreated, meaning that therapy must start early.
In practice, however, the process of choosing the right treatment is often a source of misunderstanding. The hope for swift recovery from the patient's point of view is complemented by the deep faith in the universal remedy, antibiotics, a common misconception.
Those cases in which antibiotics are the right choice for treatment of bronchitis are extremely rare, because in 90% of all cases, bronchitis is caused by viruses, and viruses are not susceptible to antibiotics. It's thus malpractice to treat 90% of acute bronchitis cases with antibiotics.
And yet, this is exactly how it is done as part of standard practice in Germany, regardless of the hazards involved not only for society, but also for each individual.
The crucial point is that any therapy with antibiotics breeds resistance to antibiotics, right from the very first dose. This resistance develops in the patient's intestinal flora and in the skin flora. In the meantime, resistance to antibiotics has become one of the most serious infection-related problems worldwide. Not too long ago, the WHO publicized the fact that worldwide, more patients die from infections caused by pathogens resistant to antibiotics than from AIDS. This is a statistical fact which should really make us stop and think.
The standard practice of prescribing antibiotics is also routinely applied to children with acute bronchitis, who are actually regular visitors in doctors' surgeries during the cold season.
Children usually suffer a lot more from respiratory tract infections than adults because their respiratory passages are smaller, and when they swell and become congested with mucus, breathing problems are much more common. Preschoolers in particular will sometimes have between 8 and 12 infections per year, which is quite a pain in the neck for their parents, as the mothers or fathers will have to stay home from work, depending on the individual family model. So this is actually an issue of considerable social impact.
As there are more and more families with 2 working parents today, the pressure on the labour market also affects the way parents deal with their children's frequent respiratory tract infections.
The parent takes the child to the paediatrician looking for an efficient solution. The paediatrician knows that a virus infection as such is quite natural. The child is supposed to fight against the virus, to identify the virus, so that next time around, the same virus won't make the child sick again. However, frequently neither the patients nor the therapist have the patience. Their reaction will be, I definitely don't want to run the risk of this turning into a severe purulent bronchitis or pneumonia, so let's give the child some antibiotics as soon as possible with any negative consequences associated with it.
The main reason why antibiotics are often used too early but unnecessarily is the fear of a bacterial superinfection, which is indeed serious but fairly rare. This is a tough and long-lasting condition, starting with an inflammation of the mucous membranes. The removal of mucus is hampered by evident flaws in the carpet of cilia. Too many cells have already died. The mucus accumulates and thickens. The airways become congested, resulting in a tickle in the throat and an urge to cough. For the bacteria, some of which can always be found on the mucous membranes, the situation could not possibly be any better. Up to this point, the body has been able to keep them under control. Now, however, in the accumulated mucus, they gain the upper hand, as this is the perfect environment for them to proliferate.